Hello, today is World Hepatitis Day. I would like to introduce hepatitis. What is hepatitis? Hepatitis is simply inflammation of the liver. What are the causes of hepatitis? The important causes are the viral hepatitis, which can be acute A and E, which can be acute on chronic, which is hepatitis D. Hepatitis which are chronic are hepatitis B and C, and we have other hepatitis. The common which we see and which is increasing in intensity is alcoholic hepatitis, and sometimes hepatitis due to drug-induced hepatitis and varied hepatitis. What is concentrated on World Hepatitis Day is hepatitis B, but we must pay attention to the other hepatitis also.
I would like to talk about the fecal-oral borne hepatitis, hepatitis A and E. They are acute form of hepatitis which usually presents as jaundice, and it is one of the most common cause of jaundice in our community. It is transmitted by infected food, infected water and other infected substances. How can we prevent it? We can prevent it by safe hygiene practices. It is usually spread by flies which contaminate the food, and also we should avoid extra burden on the liver by using excessive of drugs, and we should avoid using other supplementary medicines, which is very common practice in India. Another way of preventing this is vaccination for hepatitis A.
So I would like to talk about hepatitis B and C on the occasion of World Hepatitis Day. So hepatitis B and hepatitis C both are blood-borne viruses which mainly transmit through blood-to-blood contact and body fluids, and also unprotected sexual contacts. And hepatitis B is a chronic disease, so ultimately may lead to liver cirrhosis, liver cancer, and sometimes ultimately may lead to liver death also. So this is basically transmitted through blood and blood products. So sharing needle, sharing razors, sharing toothbrush, unprotected sex, and nowadays the tattooing is a fashion is going on, so proper prevention is not taken during the tattooing. The transmission rate is high. Now we have good modalities to prevent from the hepatitis B and C. So we have vaccine for the hepatitis. For hepatitis C, we don't have vaccination, but we have good treatment options. So early diagnosis and treatment is possible.
Today specifically, I would touch upon two definite kind of hepatitis which are related to human habits. One is alcohol. We know that alcohol consumption is very wide in the society. We should also know that around half of the liver cirrhosis related death all over the world is related to alcohol. Another issue I would like to bring to the viewer is the drug abuse or some toxic material related liver injury. From the drug abuse, because of sharing of the needles, diseases like hepatitis B, hepatitis C and HIV get spread among the needle sharing individuals. Because of jaundice or because of any kind of liver disease, so many unproven or uncertified medicines are prescribed or given by quacks in the villages or in the community. Please stop them, please don't use them. If you have any liver related problem or hepatitis or jaundice, consult a certified doctor.